Welcome to Mental Health Part 1. Benzodiazepines, Ativan, good for elderly. Valium, long-lasting, lipophilic. Halcion, very short-acting. Taper down. Z drugs, similar in action, different structure. Ramelteon, not very effective, but hydroxyzine is picking up, starting to be sold more for nursing home patients. Very effective, but it can give some serious anticholinergic problems. Buspar or Buspar, different type of action, not very clear, but you can take this if you've had alcohol. Any of these other anti-anxiety drugs, you can't have alcohol. Takes time for this to work, and the good news about it doesn't make you groggy like the benzos, but it's not as potent. Tricyclic antidepressants, action is there. Pamelor and Pam, no trip, nortriptyline, less falling, there's less alpha blocker. The amitriptyline is still being used for urinary incontinence, and as well as for sleep, because it has a H1 blockade. And Afrinil is shaped like a TCA, but it doesn't work like it. It's used mostly for obsessive compulsive disorder, and it's basically an SSRI action with a TCA. It's just an unusual product. Here are the real live SSRIs right up here, and the first two are activating, Paxil, and the others can be more sedating. This is the one that's anticholinergic, so SSRI, this one can never be used by an Alzheimer's patient. And they all can cause sexual impairment and serotonin syndrome. The new one is called Brintalex, and it's similar to the SSRIs, but it hasn't been used yet. Deseril, Cerazone, these are mild SSRI, but different type of action, less cardiovascular problems, and truly no reports of sexual problems with this. But in males, the trazodone can cause priapism. It's rare, etc. Effexor works like a TCA, even though it's not, and it seems to be used quite a lot. Pristiq is similar to it. Cymbalta went after the pain and ache indication. Fibromyalgia, it's very widely used. Similar products, Savella and Fedzima, nothing happening yet. Wellbutrin, very activating, dopamine reward, so it's good for people who need a good antidepressant and they don't want the SSRIs because of sexual impairment. This has no sexual impairment. Here are your monoamine oxidase inhibitors. We covered the adverse effects, the cheese reaction, etc. This has to be a washout period, etc. Antipsychotic drugs, Mellaril and Haldol, and Thorazine. Thorazine is another one up here. These are very powerful dopamine 2 blockers for more of the aggressive, the agitated states, where the atypicals are more for the people who are elderly and possibly for people who have negative symptoms where they're withdrawn. Now, even though elderly are at high risk for cardiovascular problems, still these are preferred for the elderly. They cause less EPS, but they have weight gain. Some of them do, some don't. The two that don't are Geodon and Abilify. So these two are for people who are seeing visions or paranoid, and they need a good antipsychotic. And if they're diabetics, they can use these two. Sarfus is relatively new. They claim less EPS. This is all about serotonin syndrome. And in 4 minutes and a half, there's your snippet. Lots of luck. See ya.